The opening of yet another primary healthcare district health facility is by no means accidental. It is part of a conscious, orchestrated, and carefully planned effort towards strengthening primary healthcare facilities in Trinidad and Tobago. In fact, it is in keeping with the Ministry of Health's strategic objective of preventive healthcare. Ladies and gentlemen, primary healthcare has long been accepted by all WHO member countries as the key to achieving the goal, health for all. As people all over the world become more and more frustrated at the inability of today's health systems and services to meet their needs, demand for a renewal of primary healthcare and health for all is increasing. Thus, the ultimate goal of primary healthcare is better health for all. WHO has identified 5 key elements to achieving that goal: reducing exclusion and social disparities in health, organizing health services around people's needs and expectations, integrating health into all sectors, pursuing collaborative models of policy dialogue, and increasing stakeholder participation. As the Director General of WHO, Dr. Margaret Chan, has put it, primary healthcare is a people-centered approach to health that makes prevention as important as cure. As part of this preventive approach, it tackles the root causes of ill health, also in non-health sectors, thus offering an upstream attack on threats to health. Therefore, guided by decades of international experience and WHO guidelines, we now fully recognize and appreciate that a primary healthcare approach is the most efficient, fair, and cost-effective way to organize a health system. Such an approach can prevent much of the disease burden, and it can also prevent people with minor complaints from flooding the emergency wards of hospitals. If we apply that in our environment in Trinidad and Tobago, we can easily see how the strengthening of our primary healthcare network can also give a boost to our secondary and tertiary healthcare facilities. We are now confident that primary healthcare produces better outcomes at lower costs and with higher user satisfaction. And this is exactly the direction we've been taking at the Ministry of Health as we seek to meet the demands of our population and take public health care to another level comparable to international best standards. In a nutshell, my dear friends, primary health care is people-centered care which encompasses inclusive leadership. And I want to take the opportunity today, since we have with us community leaders and opinion makers, to say that we need to shift from conventional command and control approaches in healthcare to a model emphasizing increased participation of all stakeholders. In essence, we need to increasingly move from supply-led to demand-led policies and programs in health and stress initiatives at the community level. Healthcare in the community, led by the community. Building a strong primary healthcare network is a first important step towards that direction, since primary healthcare is the first contact point a person should have with the healthcare system. Primary healthcare centers focus on the prevention and treatment of common diseases and injuries, basic emergency services, general practice services, referrals to and coordination with other levels of healthcare, such as hospitals and specialist care, health promotion, and maternal and pediatric health care. On the other hand, secondary and tertiary healthcare institutions, such as our hospitals, focus on major emergencies and higher-end complex needs, such as surgeries and inpatient services under the care of a specialist. Two different sets of delivery. Therefore, citizens in need of services pertaining to antenatal and postnatal care, cervical screening and pap smear, child health, chronic diseases, family planning, general practice, substance abuse counseling and prevention, school visits, psychiatry, as well as medical social services, dental services, dressings, pharmacy services, and certain lab services should seek them at the primary healthcare level in the first instance and only through referral at the secondary health care level. Additionally, as most of you already know, over the last few years, the Ministry of Health has been actively promoting the wellness concept as part of our strive towards preventive health care. This strategy is also geared towards fighting the scourge of CNCDs in our nation. Our health promotion initiatives to that end are ongoing. Ladies and gentlemen, you may recall that we've also launched the Healthy Communities Caravan in order to strengthen our health education initiatives in at-risk communities. Already we have visited communities such as Windy Hill, Lopino, Sealots, and La Tosca, and this is a program we're going to be rolling out through Trinidad and Tobago, taking wellness to you and education to you and material to you and testing and so on as we seek to build a healthier nation. This program, themed Empowering Communities to Achieve Well-Being, utilizes the health fair format to showcase a range of health awareness programs, including services to sensitize and create awareness about family planning and diet and nutrition. Screening for blood pressure, cholesterol, and glucose levels are also provided through the caravan. And this is just a touch of what we're doing. We're not talking about the schools and our nutrition policy and all, just a small part of it. Well, not a small part, but it's not the complete range. On this note, I urge all citizens to heed the best healthcare advice available today and to take personal responsibility for their health. Get advice, make healthier food choices, drink responsibly, and certainly stop smoking. Let us resolve that we will take service, kindness, and caring to the next level. In fact, all of us in the health sector need to take ownership and efficiency to a higher level and embrace our jobs as opportunities to make invaluable contributions to our society. Ladies and gentlemen, as healthcare professionals, we have a double duty to give our best. Our preventive focus determines that we must become advocates of good health, and in negative health circumstances, we must extend our care to the most vulnerable in our society. The people in pain, their relatives who support them and suffer along with them, those who have been through terrible accidents, as well as those who have been victims of violence and crime, and people who have fallen terminally ill. It is also interesting to note that according to a moh4 report, most healthcare workers love their job. Therefore, I call on all members of the national community to respond to that love with the appreciation that the healthcare professionals deserve, so that they are inspired and further encouraged to go the extra mile. Once again, I extend my appreciation to all those who contributed to making the Chaguanas DHF a reality and to all our healthcare professionals. I thank you for your continued commitment to our nation's health. May we all strive to be more efficient and caring in the execution of our duties in 2010. I thank you, and may God richly bless all of us.